Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 9 homeopathic remedies for enteritis. What is enteritis? Term enteritis has come from enteron, means small intestine, and itis means inflammation. But for all practical purposes, the term also embraces gastroenteritis, inflammation of stomach, and enterocolitis, that is inflammation of large guts. That is the whole of the digestive tract. Inflammation of whole of the digestive tract is called enteritis. Practical purpose. Can enteritis pose a serious threat? It is seldom so long as dehydration through diarrhea, dysentery and vomiting is under control and the casualty gets enough rest. It is just a matter of time. However, if there is a frank overwhelming bacterial infection or also dehydration is there, some emergent situation, some emergent extra action is necessary. Some of the action is just given here a picture, that is external drip is required. These are the inflammation of guts images. What are causes of enteritis? There are 4 distinct causes of enteritis. Number 1, infectious enteritis, most common type, inflammatory enteritis, radiation enteritis, ischemic enteritis. What are symptoms of enteritis? Fever, nausea, vomiting, diarrhea, body ache, stomach ache, loss of appetite, occasional bloody stool. What are complications of acute enteritis? Most common yet gravest complication of acute enteritis, acute gastroenteritis, is dehydration. Symptoms are headache, dizziness, weakness, dry mouth, tachycardia, low BP, dark scanty urine, sunken eyes, etc. etc. There is other symptoms also. What are complications of chronic enteritis? Chronic enteritis resulting from radiation therapy or inflammatory bowel disease may have any of the following serious long-term side effects: anemia, chronic diarrhea, abdominal cramps, abdominal distension, nausea, partial obstruction of small gut. Does enteritis go on its own? Yes. Generally, enteritis goes away on its own. Infectious enteritis goes within a week. Radiation enteritis takes a few weeks to go. However, if there is a chronic condition that causes recurring gastroenteritis, then symptoms usually go and reappear. When to consult a doctor in case of enteritis? If you are under self-care for tending enteritis and there is no relief in 4 days, you are under self-care and there is no betterment in 4 days, then you have to consult doctor. If you are vomiting for 2 days, if a child has a diarrhea for more than 24 hours, if signs of dehydration, that is dizziness, headache, tiredness, dry mouth, lip, eyes, confused state, bradycardia, tachycardia, that is blood rate low, heart rate low, heart rate high are there, fever about 104 degree Fahrenheit, blood vomiting or blood stool, sudden severe stomach pain. Any of these symptoms, you have to consult doctor immediately. How to prevent enteritis? Prevention of enteritis is a very important thing. There are a few preventable steps to avoid enteritis, such as wash hand with soap and water after visiting bathroom. Wash hands with soap and water after visiting bathroom. Cook meats and fishes thoroughly. Wash kitchen tools, surfaces that have been contact with raw meat and produce. Always use bottled water while visiting foreign lands. Keep hot, cold food cold. While recuperating from diseased conditions, stay at least for 2 days at home after cessation of all signs of symptoms. Viretram album for enteritis. Repeated diarrhea and vomiting with severe pain in abdomen, cold sweat on forehead, cramps in limbs with prostration, severe retching, epigastric region painful. Epigastric region I have shown here in the picture. This region, this abdomen has got 9 quadrants. 9 quadrants has been shown. This is epigastric region, just in front of the stomach. Give biratum 6 too early. Arsenicum album for enteritis. Severe weakness and prostration. Intense thirst for little water repeatedly. Vomiting after food or drink. Watery or bloody stool. Give arsenicum 3 4 hourly. Aconitum napillus for enteritis. Sudden severe fever with fear of death. Intense burning thirst. Craving for beer, acids, bitter drinks. Projectile bloody or bilious vomiting. Give aconite 3 hourly. Chamomilla for enteritis. Violent retching before vomiting. Thirst for cold water, acid drinks. Symptom worse after a fit of anger and in night. The chamomilla 3 hourly. Chamomilla 3 hourly. Mark core for enteritis. Severe tenesmus. Stools full of mucus, bloody. Continuous urge to pass stool and urine. Great desire for cold foods, sweat before and after stool. Insatiable thirst for cold drinks with cramps in epigastrium. Epigastrium, you see this epigastrium is this region, epigastric region, epigastrium, same thing. Words from touch. Give marker 6 2 hourly. Podophyllum for enteritis. Constant gagging. Thirst for large quantity of water. Patients rub liver region always. Profuse, putrid, polychromatic, different color, multiple color, stools gush out painlessly. Incarcerated flatulence, that is the gas which doesn't move up or down, it is locked in the intestine. Involuntary stool while passing flatus. Give podophyllum 6 4 hourly. Ipecacuana or ipecac for enteritis. Colic in abdomen with diarrhea. Vomiting and incessant tendency to vomit. Thirstless and aversion to food, griping, cutting pain around navel. Navel actually umbilical region. Navel is the umbilical region. Keeps ipecacuana 3x 1 hourly. Colosynthes for enteritis. Spasmodic pain around navel or pain all over the abdomen. Nausea, flatulence. Cutting, griping, colicky pain come in waves, better from doubling up. Give Colosynthes 6 3 hourly. Belladonna for enteritis. Desire for lemonades and lemons. Great thirst for cold water. Cutting pain in epigastrium. Epigastrium, already I have shown epigastric region. Better from bending backwards. Give Belladonna 3 2 hourly. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write in the comment section. I would certainly attend.